Hi, this is my head to toe checkoff. Okay. Jessica?
Yes,
Yeah, hi, how are you?
I'm good.
Good. My name is Erica and I'm going to be your nurse today. And today I'm going to do a head to toe assessment of all your body systems. And throughout that assessment, I'm going to have to touch you in a couple different places. Is that okay?
Yes.
Okay, good. Now, so while I'm touching you, just let me know if you feel any pain or tenderness in any areas. Okay, I'm going to close this curtain so we have some privacy. Wash my hands. And put on some gloves. So during the general assessment, I noted that the patient's gait is steady, her posture is upright, she's alert, she doesn't have any slurred speech or dysarthria. Her skin tone is consistent with her ethnicity and she appears to be her stated age. There are no malodorous smells and she appears well kept. So I'm going to start the assessment with your hair, skin, and nails. And first thing I'm going to do is put on some gloves and take a look at your scalp. So the patient's hair is long and curly. All right, and it's well distributed on each side. And there are no signs of lesions or pests. Okay. And the next thing I'm going to do is take a look at your skin. And first, I'm going to check for moisture. Okay. Good. Now temperature. Okay. Do you go out in the sun much?
Yes.
Okay. Do you wear sunscreen?
Yes.
Okay. It's important to make sure you're vigilant wearing sunscreen because we're all highly susceptible to skin cancer. Do you know what you're looking for when you maybe see an irregular mole or something you may be concerned about?
No, not really.
Okay, well what we use is an acronym, it's ABCD, and the A stands for asymmetry, and that means if you cut the mole in half and fold it on top of itself, then its borders won't match. And then the B stands for border, and that's any irregular border that's not circular or an oval. The C is for color, and that's if you see something that's really dark, or if there's more than one color on the mole, that's a cause for concern. And then the D is diameter. So if it's bigger than the end of a pencil eraser, then that's a cause for concern.
Oh,
Okay? Okay. So the patient's skin is warm and dry on the upper and lower extremities. There are no signs of lesions or bruising, and her skin tone is consistent with her ethnicity. Okay, now I'm going to take a look at your fingernails. So what I'm looking for is her nails are clean and well manicured, and the nail beds are pink. There are no obvious ridges, no deformations. The capillary response for refill is less than 3 seconds bilaterally. And if you could, please put your fingers, first two fingers like this. Okay? And I can see a space between the two fingers, so there's no evidence of clubbing. And the reason we check that, you can put your hands on. The reason we check that is clubbing or rounding of the bed of the fingernail indicates chronic hypoxia or low oxygen in the bloodstream. And usually we see those in those signs in people who have smoked long term or who are heavy smokers. Okay? All right, you doing okay?
I am.
Okay, me too. Here we go. Now I'm going to check out your head and neck. And the first thing I'm going to do is I'm going to say that your eyes are symmetrical bilaterally, as are your ears. Okay, now I'm going to palpate your temporal artery. And it is +2 bilaterally. And then I'm gonna palpate your 8 sets of lymph nodes. So I'm gonna do pre-auricular, post-auricular, tonsillar, occipital, okay, cervical chain, very good, submandibular, submental, and then, move your shirt, that's a little here, and supraclavicular. So there are no palpable lymph nodes, which is good. And the next thing I'm going to do is palpate your carotid artery. I'm going to do that one side at a time. Okay, it's palpable at a +2 on the left side and a +2 on the right side. And then I'm going to just take a listen here quickly. First, I'm going to clean my stethoscope. And what I'm listening for are sounds of turbulent blood flow through the arteries, and it's called a bruit. And that may indicate a narrowing of the artery due to a plaque buildup. So we'll just take a listen here. Listen with the bell first. Okay, sounds good. I didn't hear any breweries. And I'm going to say that the trachea is midline. Okay, and before we move on, can you smile? Can you frown? Very good. Puff out your cheeks. Okay, good. Cranial nerve 7 is intact. Okay, can you clench your teeth? Very good. Now try to open your mouth. Very good. Cranial nerve 5 is intact. Now can you swallow? Very good. Cranial nerves 9 and 10 are intact. Okay, now what I'm going to have you do is just turn to the side a little. And I'm going to give you a drink of water. And what I'm doing is I'm going to palpate your thyroid gland. And it's easier for me to find it when you're swallowing. Okay? So first I'm just going to palpate the trachea. And it is midline. And then from behind, while you're taking sips of water, I'm going to palpate. Okay, so the upper left and upper right lobe are palpable. The lower left and lower right are not palpable. Okay, I'll take your drink. Okay, you can slide down here again. All right, one more thing before we move on. I want to check what's called skin turgor. And that just checks the elasticity and rebound effect of your skin. So I'm going to check it over your clavicle, both sides. And the pinch is the mobility of the skin, and the release and the rebound is the turgor. And what this is looking for is the hydration of your skin. So it's good turgor over the clavicle, and good turgor bilaterally on the lower arms, and then good turgor on the lower extremities. So, do you feel like you stay hydrated most days?
Yeah,
Okay. How many glasses of water would you say you drink?
probably about 6.
Okay. That's very good. Keep that up. That'll keep that elasticity in your skin and hydrate your whole body.
Yeah.
Okay. All right. Now, I'm going to take a look at your eyes. Before I do, I'm going to wash my hands. Put some gloves back on. All right. Under general survey, I noticed that there's no excessive eyelid drooping bilaterally. There's no evidence of exudate. So what I'm going to do is lower your eyelids here and have you look up. Okay, the conjunctiva is pink and moist, and the sclera is white and shiny, and there's no exudate present. Okay. Next thing I'm going to do is I'm going to hold my pen light here and have you keep your eyes on it and follow it all the way to your nose. Very good. Okay, so for accommodation, cranial nerve 3 is intact. And now the same thing, just follow with your eyes, my pen light. Okay, very good. So in doing that, I know that cranial nerves 3, 4, and 6 are intact, and there are no signs of nystagmus. Now, the next thing I want you to do is focus on an object on the wall behind me and cover your right eye. Okay, very good. Now you can put your hand down. Now cover your left eye. Okay, you can put your hand down. So there's no sign of strabismus. All right. Are you still doing okay?
I am.
Okay. Next, I'm going to take a look at your visual acuity. So I'd like for you to hold that about 14 inches from your face and read the smallest line you can clearly read.
937-826.
Okay. Okay, so visual acuity is 20/20, and cranial nerve 2 is intact. All right, now for the fun part. I'm going to shine some light in your eyes. And all I'd like you to do is focus on an object behind me again. Okay. Very good. Now I'm going to shine the light right on your nose and just keep looking straight ahead. Okay, very good. So the patient's pupils are equal, round, and reactive to light and accommodation, and the corneal light reflex is good bilaterally. All right, one more test on your eyes and then we'll be finished. With the eyes. All right, so just look straight ahead. Good. Very good. Okay, the red light reflex is good in both eyes. All right, take these gloves off. And take a look at your ears. So, I'm going to move your hair out of the way here. And what I'm looking for here is any sign of lesions or sun damage. So, there is no evidence of sun damage or lesion or pain palpated on the left side. And I'll move to the right side. Okay, no sun damage or lesions or pain palpated on the right side. And the patient has 2 lower lobe ear piercings bilaterally. All right, the next test I'm going to do is called the whisper test. And I'm going to whisper 3 words on your left side and then on your right side, and I'd like for you to repeat them back to me. Okay? Joe, basket, chair.
Gel, basket, chair.
Very good. Weird words.
Gel.
Okay. Bed, rail, light.
Bed, rail, light.
Okay, very good. Cranial nerve 8 is intact. Good job. All right, I'm going to take a look inside your ear now. And I just want to remind you, it's important to only clean the outer surface of the ear and not to stick anything inside the ear to clean it, even Q-tips. Because when you do that, you risk the possibility of presenting bacteria into the ear or causing damage to the ear canal or eardrum. All right. We're in business. Okay. There it is. Okay, the tympanic membrane is a pearly gray with shine. There are no signs of inflammation, reddening, or exudate. And take a look at your right ear. Okay, same for that side. the tympanic membrane is a pearly gray and it's shiny, and there is no redness or through the ear canal or inflammation noted. Now I'm going to check out your nose. Okay? You still doing good?
I am.
Okay, we're getting there. Okay, first I need you to cover one nostril with your finger and inhale through your nose. Okay, now do the same on the other side. Okay, so nostrils are patent bilaterally. The next thing I'm going to do is look up in your nose. Okay? Bring your head back just a little. Good. Okay, so turbinates are pink and moist. There's no sign of obstruction or septal deviation noted. Okay, this is the fun part. So what I'm going to do is I'm going to have you close your eyes, and then I'm going to wave a scent in front of your nose, and you tell me what you smell. Sounds good. Ready?
The beach.
Very good. It's called like mermazing. That's perfect. Okay, so cranial nerve 1 is intact. Okay, so we've done eyes, ears, nose, and all that's left is mouth. Okay, so before I do this, I'm going to wash my hands again, put some gloves on. Okay, and on a general assessment, general survey, I noticed that the patient's lips are pink and soft. There are no signs of lesions or cracks or any deformities. All right. Okay, so I'm just going to ask you to open your mouth. I'm going to take a look inside there. There we go. All right. So the hard and soft palate are both intact. The mucosa is pink and moist. The gums are pink and moist as well. The teeth are clean and white and free of dental caries. So you can put your tongue up on the roof of your mouth. Okay. So the floor of the mouth, there are no indications of lesions or cuts. Okay. Give your mouth a break for a second. Do you have a strong gag reflex?
No, I didn't before.
Okay, okay, well, I'll be easy on you today. Okay. So I'm just going to take a look at the back of your throat. Can you say ah?
Ah.
Okay, very good. Okay, so the tongue is pink as well. There's no sign of lesion on this either side of the tongue. And the up and down movement noted on the patient said ah indicates that the cranial nerves 9 and 10 are intact, and I would grade the tonsils, as 0 because, well, they're not there. So, for my final trick, can you say the words light, tight, and dynamite?
Light, tight, and dynamite.
Okay, so cranial nerve 12 is intact. One more test before we move on. I'm going to place my hands on your shoulders and ask you to shrug your shoulders. Very good. So cranial nerve 11 is intact. So for a quick mental review, what I'll say is I assess cranial nerve 1 through smell, 2 through acuity, 3 and 4 through accommodation, 5 is the Masser test, 6 is also eye ocular movement, 7 was smile, frown, puffing the cheeks, 8 was the whisper test, 9 and 10 was swallowing, 11 was shrugging your shoulders, and 12 was saying light, tight, and dynamite. Cranial nerves 1 through 12 have been assessed. Okay. Are you still doing okay?
I am.
Okay. You need to take a break? You
No,
need to drink
good.
water? Okay. I do, but that's the point. Okay. Next thing I'm going to do is assess your lungs. So the first thing I'm going to do, you just sit still and breathe normally,
Okay.
is I'm going to watch the patient breathe, and I assess that her precordial area rises and falls symmetrically, bilaterally. Can you see me? Symmetrically, bilaterally with respiration. And then on the back, I noticed the same thing. Expansion symmetrically and bilaterally with respiration. I also don't note the use of any accessory muscles for respiration. Okay. So the next thing I'm going to do is take a listen to your lungs. And each time I place my stethoscope in a new location, I'm going to need you to take a deep breath in through your nose and out through your mouth if you can, okay? Alright. So, first things first. I should put them in my ears. Okay. Deep breath. One more time. Very good. So in this area, I'm listening for bronchial sounds. Very good. There's no indication of wheezing or crackles. And then I'll just do this up your shirt. Okay, deep breath. Very good. One more. Very good. So in this area, I'm assessing bronchovesicular sounds, and there are still no indications of wheezing or crackles there. All right, now I'm going to feel your back, and if you don't mind, turn that way. All right, deep breath. Again. 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 Okay. One last time. Okay. So I didn't auscultate any wheezing, crackling, in any areas, upper or lower, of the lungs, which would indicate to me that there's no fluid in the lower lungs, which will be represented with a crackle. All right, so the next thing I'm going to do is put my hands on their lower back and ask you to inhale deeply. Okay, and exhale. Okay, so the expansion was symmetrical bilaterally. Okay, you can slide around here again. Next thing I'm going to do is listen to your heart sounds in a couple different places. Okay? This thing on? It's on. Okay. First thing I'm going to listen to is the aortic valve, and just breathe normally during this. And that's the pulmonic valve. So in the aortic and the pulmonic valve, S2 is heard louder than S1, and I didn't auscultate any extra heart sounds or whooshing sounds to indicate murmurs. This is the tricuspid area. So in this area, S1 is louder than S2, and there are no extra heart sounds. Okay? Then finally, if you don't mind, lift your arm up just a little here, and I'm going to listen to the apex of your heart, the mitral valve. Okay? You can put your heart down in that area as well. S1 is heard louder than S2. And upon oscillation of heart sounds, I didn't hear any additional heart sounds or murmurs in any of the four areas. All right, for this next trick, I'm going to lay your head back and ask you to roll over onto your left side and support your upper body on your elbow on your left side. So let me get your table down. This worked in pre-flight. So by the time we get this down, your heart rate will be elevated. Aha! We win. 1 us, table 0. back and then prop your upper body. And the reason I'm putting you into this position is I'm trying to palpate the pulse and the very top of your heart, which is the apex. And gravity in this position will allow me to feel that pulse more easily. Okay, and the point of maximal impulse, you can go ahead and sit up. The point of maximal impulse was easily palpated. All right, so we've done lungs and heart, and for the next event, I'm gonna take a look at your abdomen. Okay, so if you don't mind, just lay back. Okay, and I'm gonna pull your shirt up just a little bit. That's okay. Okay? All right. So I noticed that the belly is flat. There are no obvious signs of masses, no irregular lesions or moles. There is one macule in the upper left quadrant, which looks normal. No cause for concern. Okay. I'm sorry? Sort of. I'm going to adjust the screen just a little so you can see my patient. Okay, so I hit the wrong button when I was trying to adjust the screen and I shut it off. So just starting where I left off. Okay. Okay, so the next thing I'm going to assess is your abdomen. And in order to do that, I'm going to lay this chair all the way back. And if you could lay back, please. And I'm going to lift your shirt. Is that okay? Okay, so the first thing I'm looking at is the belly is flat and the skin tone is consistent with her ethnicity. And it doesn't look like there are any irregular moles or lesions present. Okay, so you just lay there and relax. And what I'm going to do is listen to your bowel sounds. All right. Yeah. So bowel sounds are present in all 4 quadrants. And now I'm just going to lightly palpate. And hold on, let me adjust this a little bit. Now I'm just going to lightly palpate all 4 quadrants. And I'm looking for any masses. Okay. No masses are present. Now I'm going to percuss. There's a dull sound over the area of the liver and tympani on the left upper quadrant and tympani over the right lower quadrant as well. Okay, the last thing I'm going to do is try to palpate the lower edge of your kidney, and it won't hurt, I promise. Just when I tell you, take a deep breath. Ready? I'm sorry, I must have said liver. I meant liver, the lower edge of the liver. Take a deep breath. All right. Are you okay? Doing okay? Okay. The liver is not palpable. All right. Now you can pull your shirt down, and I'll help you sit up. Very good. I'm going to lift this chair back up and get its position. Okay. So that was the abdominal assessment, and now I'm going to do the musculoskeletal assessment. So if you would, just for this beginning part, turn to the side. Okay. I'm going to palpate your cervical and thoracic spine. Do you feel any pain as I'm doing this? No. Okay. Good. So I would say that the spine is aligned vertically and there's no pain upon palpation. All right, you can turn back around this way. All right. The next thing I'm going to ask you to do is look up. Okay, now look down and look left. Sorry, your left. And now to your right. And now turn your head all around. Okay, so there's good range of motion there. All right, next thing I'm gonna do is ask you to close your eyes and put your arms out like this to your sides and touch your nose with both of your fingertips. Very good. Now can you do it one at a time? Very good, very good. Okay, you can put your arms down. And now take the heel of one foot and place it on the shin of the other leg. Very good. Now do it to the other side. Very good. Okay. Now I'm going to hold my hands here and I'm going to ask you to squeeze my hand. I'm going to test your grip strength. Okay? Grip strength is strong bilaterally. All right. Now I'm going to do your foot strength. So I'm going to place my hand here and just press the gas pedal. Okay? Foot strength is strong on both sides, so bilaterally. Very good. Okay. And while I'm at your lower extremity, do you mind if I take your socks off? Okay. One thing I need to do is check for edema. So I'm going to check it in your lower extremities. And what I'm looking for is the recovery of the skin after I place my finger in it. And there are no signs of edema in the lower extremities. I'm also going to check your upper extremities. No sign of edema. And all edema is a retention of excess fluid, and it can be an indication of congestive heart failure. But in your case, there's no sign of edema, so you're good to go. And while I'm down here, I'd also like to test the pulses in your popliteal area, which is the area behind your knee. Okay. And it's a +2 on the left side. And a +2 on the right. Then I'm going to test, I don't know if you can see it, I'm going to move this back. The posterior tibial pulse. And it's +2 on the right. And +2 on the left. And then your dorsalis pedis pulse. Okay, +2 on your right. And +2 on your left. Okay, you can let your legs down. Okay, so we went a little out of order on that one, but I wanted to make sure I got everything before we moved on. Okay, the next thing I'm going to do is fun. Okay, so I'm going to ask you to close your eyes, and I'm going to use the tip of this stick and a cotton ball in different areas of your body, and I need you to tell me whether you feel a sensation of pain or soft. Okay, make sense? Okay, close your eyes.
Sharp. Soft.
Okay.
Sharp. Sharp. Soft. Sharp. Soft. Sharp.
Okay. And now your lower extremity.
Sharp. Sharp. Soft. Sharp. Sharp. Soft.
Okay, very good. Lastly, I'm going to ask you just a few questions before we move on to your vital signs. So, first question is, do you know what day it is?
Yes.
What day is it?
Thursday.
Okay, very good. And where are you?
I'm at UC in room 319.
Okay. And who is the king of pop?
Michael Jackson.
Good, very good. So the mini neuro has been completed and the patient is aware and situationally aware and alert. Okay, now on to your vitals. And this, we're on the home stretch when we get to this part. All right, so the first thing I'm going to do is place this little gadget on your finger. This is called a pulse oximeter, and it measures the oxygen level in your bloodstream. And then I'm going to set you up here to take your blood pressure. Okay. Yeah, just rest your arm right there. And in the meantime, I'm going to take your temperature. your temperature is 98.9. All right, before I take your blood pressure, I'm just gonna check your pulse here. So your respirations are 18 and your pulse was 90 and your pulse oximeter reads 99% saturation and your pulse at 97. All right, so now I'm going to palpate the brachial artery. Okay, and I'm going to find your systolic threshold. So your systolic threshold is about 140. And I'll let it out of here come out. And stop, let your arm rest for just a second. You're almost done. I promise. Alright. Put this back on you. And I'll take your blood pressure. Okay, 120/82. Okay, and my last question for you today, are you in any pain?
No.
No? Okay, good. That completes my head to toe assessment. Do you have any questions for me?
Nope.
Okay, good. Your doctor will be in to see you. Bye.